So I think you guys had information last semester, but we're gonna just kind of briefly review it. So it's the body trying to protect itself, an immunologic defense against tissue injury, infection, or allergy. So just trying to maintain homeostasis. So a lot of things that the body does are like that. It's just sometimes it doesn't help. Sometimes it ends up causing as many problems as it helps. So examples of injury: mechanical injury, you cut yourself, you break your leg, get in a car wreck, and get a crushing injury, something like that. And most of these others are pretty obvious. Chemical would be like a chemical burn, electrical burn, thermal burn. Radiation injury, that can cause damage to the tissues. I don't know if anybody's known anybody that's had radiation. Now they focus it very directly on the spot that they're getting it, but years ago they didn't. So when my mother had breast cancer, she had radiation therapy afterwards, and they marked off like this whole upper quarter of her trunk and radiated the whole thing. And I remember her back being burned. You could see it. So, and then years later, we found out she had pulmonary fibrosis from it. Well, we couldn't get her off the ventilator. Anyway, okay, so biological assault would be viruses, bacteria, fungus. And then categories: immediate, the acute inflammation would be the immediate response. And then chronic inflammation is inflammation that lasts for weeks to years. The tissue repeatedly being destroyed and repaired. So it goes back and forth, back and forth. And then repair restorative is what happens when things go right, when the inflammation does what it's supposed to do. And ends up in restitution of normal functioning cells after injury. And then fibrous repair would be like scar tissue. Okay, and I'm not going to go through all these steps, and it's a whole lot for one slide, but so the vasodilation and increased blood flow, it just kind of gives you an idea of why the signs that you will see occur. So you're going to see redness from this, right? Swelling and retraction of activated endothelial cells. So you got the redness, the swelling, and then sometimes you have weeping from the skin, and then exudate formation where you see like purulent discharge. So consequences can be local tissue damage from compression, like if a burn patient gets compartment syndrome because the tissue is just swelled so much that it's pressing on the blood vessels and nerves. And then you can get development of chronic inflammation. Systemic pathology would be sometimes results in like atherosclerosis. High blood pressure over long term can cause kidney damage because of the damage to the blood vessels that supply the kidney. And it can cause heart damage because of the damage to the blood vessels. And then it allows atherosclerosis to happen because they've got like roughened edges of the blood vessels on the inside, and then clots and other debris can get stuck there and block off blood supply. And anyway, okay, so interrelated concept: causes, inflammation, infection, and immunity, the immune response. And you probably know people who have an autoimmune disease, lupus, juvenile rheumatoid arthritis, or adult rheumatoid arthritis. There are many immune diseases, autoimmune diseases, where the immune system just goes into overdrive and attacks the body. And then most of these are pretty obvious, so I'm not going to really go into, but these are the effect. Those are the interrelated concepts. So, what's cholecystitis? Anybody? Inflammation of the gallbladder. And so the main cause of it is gallstones. 95% of the people that have cholecystitis, it's from gallstones. And the term for that is cholelithiasis. But most of the time we just call it cholecystitis because it's the main kind that happens. The acalculous kind, which means no stones, happens in 5% of people, but it's usually sepsis or severe trauma, so some kind of severe assault on the body, or long-term TPN. Because TPN, total parenteral nutrition, is not benign, so it can actually cause cholecystitis, it can cause liver damage, so sometimes it's the only way we can nourish somebody, but a lot of times the treatments that we have to balance the benefit and the risk. But if somebody's gonna die from not being nourished, then you take the risk, right? Makes sense. Okay, so here's a picture of where the gallbladder is, the bile ducts, and what happens is a stone blocks the duct, and then the bile gets backed up in here. The bile is produced by the liver when it comes into the gallbladder for storage, and then it goes down into the duodenum down here. So let's see if we can move this side. There we go.
Dyson Purifier warms you in winter, cools you in summer, to automatically
Hello, I am Carl Lowe Jr. from Carolina Surgical of Charlotte.
I'm sorry.
And in this video, I'm going to review some basic gallbladder anatomy and show how stones in the gallbladder cause abdominal pain, and also how removing the gallbladder can alleviate that pain. The gallbladder is located in the right upper abdomen underneath the liver, just behind the rib cage on the right side. The liver produces bile, which is used to digest food. The bile is secreted down the bile ducts and stored in the gallbladder. Whenever you eat a meal, the gallbladder contracts and it pumps the bile down the bile duct into the intestine, where again that bile is used to help digest foods, especially fatty foods. If you develop stones in the gallbladder, then one of those stones can roll into the neck of the gallbladder and obstruct it. Now, when you eat a meal, the gallbladder is trying to pump, but it's pumping against an obstruction. For that reason, it can't empty its bile, and that can cause severe pain in the right upper abdomen. The pain can also be in the central upper abdomen, and the pain can radiate around to the back or shoulder blades, and can be associated with nausea or vomiting. Typically, you'll have that pain until the stone rolls out of the way back down into the gallbladder, and once that happens, the gallbladder can empty. Because the stone can roll in and out of the neck of the gallbladder, the pain can come and go, and that's very classic and typical for gallbladder pain. The solution is to remove the entire gallbladder, stones and all, and what we do is place a clip across the cystic duct, which is the duct that connects the gallbladder to the common bile duct, and then we remove the gallbladder. This treatment is very effective at alleviating the symptoms of gallstones, and you can see that since the liver is the organ that makes the bile anyway, bile can still flow normally down the bile duct into the intestine for normal digestion after surgery.
Well, I hope that answers some of your